Hey guys, my master's project topic was ankylosing spondylitis. Ankylosing spondylitis is a type of chronic inflammatory arthritis which is due to increased immune cell activity within the body. This increased inflammation eventually begins to affect the joints, ultimately leading to fibrosis. Most commonly, this occurs in the spine and the sacroiliac joints. This condition is most frequently presenting in young males and is strongly related to the HLA-B27 genes. Other conditions that we can see with this gene include reactive arthritis, inflammatory bowel disease, and psoriatic arthritis. So when assessing patients, the number one presenting symptom with ankylosing spondylitis is usually joint pain and stiffness. This typically begins in the lower back and hips. And this is an inflammatory type pain, which means it is typically worse in the morning and improves with movement throughout the day. Any young male presenting with chronic inflammatory type pain should raise concern for ankylosing spondylitis. On physical exam, patients will most often have limited range of motion and stiffness affecting the joints. Patients may also have a history of anterior uveitis. This presents with sudden onset of eye pain and blurry vision. And anterior uveitis is the most common extra-articular manifestation of ankylosing spondylitis. Many patients will also develop inflammatory bowel disease, and other constitutional symptoms may be present. These include things like fatigue, shortness of breath, and weight loss. While not usually present on initial assessment, those with long-term inflammatory joint damage may develop fused vertebrae and ultimately kyphosis. Chronic inflammation can also cause damage to the large arteries, which would result in aortitis or cardiomyopathies. The diagnosis of ankylosing spondylitis can be difficult to make, especially early on into the disease course. This diagnosis is primarily made based on clinical presentation, but laboratory and imaging findings can help. Most patients will have elevated inflammatory markers like ESR and CRP, and up to 95% of those with ankylosing spondylitis will have a positive HLA-B27 marker. So if you are seeing a patient who is a young male with inflammatory type back pain that's been going on for a while, then it would be reasonable to order an HLA-B27 or to look for inflammatory markers. Imaging findings are not always present, but sacroiliitis is the most common finding, which is shown by the presence of erosions or widening of the joint space. Bamboo spine is a hallmark imaging finding, which is due to the presence of syndesmophytes and the straightening of the spine. This is a very late finding in progressed disease. MRIs can be used in cases that are highly suspicious for ankylosing spondylitis but lack the characteristic imaging findings on plain X-rays. MRI can be very helpful as it can detect early inflammatory changes. There are a variety of treatment options available for patients with ankylosing spondylitis, and these can be tailored to the specific disease process and to fit the needs of the individual. Most commonly, treatment should be initiated with NSAIDs. These drugs are excellent at decreasing inflammation and providing pain relief. However, caution should be used as these can come with long-term side effects such as the risk of chronic kidney disease or gastric ulcers. For patients who fail NSAID therapy, disease-modifying treatments can be initiated with biologic agents. These are those such as TNF inhibitors or IL-17 inhibitors. These agents also come with potentially risky side effects and begin to work over the course of weeks to months. The non-pharmacologic treatment of choice is exercise. Initiating an exercise routine is recommended to all patients early on into the treatment plan. Exercising is extremely beneficial for patients as it strengthens the muscles that support the joints, as well as decrease inflammation and provide pain relief. So my review of current research specifically looked at if a certain form of exercise provided the most relief of symptoms or had more significant improvement in the patient's quality of life over any other exercise method. I compared the effects of cardiovascular training, strength training, and flexibility and mobility training. Throughout my research review, I consistently found that all exercise provided patients with relief from pain and stiffness, decreased inflammation, and slowed disease activity, as well as improved the patient's overall quality of life. However, one study found that Pilates had a statistically significant improvement in mobility and functionality when compared to a traditional combination of aerobic exercise and strength training. My main takeaway from this literature review is that patients should be highly encouraged to implement any exercise regimen into the disease course early on. This could be any combination of strength training, cardiovascular exercise, Pilates, yoga, etc. If the patient can maintain consistent and routine movement into their lifestyle, they will reap many benefits that exercise has to offer, such as improved functionality, mobility, and quality of life. And lastly, here are my references. Thank you.